One. Okay, there we go. I know some of you have been in the waiting room for a while. Sorry about that. We are trying to figure out some of our technology, but I think I know all of you. I am Jawanda Mast, and I'm the manager of grassroots advocacy for the National Down Syndrome Congress, and we're thrilled that you are sharing your time with us today. What we're going to ask you to do is to please mute yourselves. We will do questions at the end of the call, and we would also encourage you all to please put questions in the chat, and we do our best to answer those during the call. However, if we don't get to a question, we will follow up with an email, or we may need to find more information, and we would do the same. We would email you. You all should have our contact information, which is also at the end of our presentation, and you can email us anytime you need to. The call is being recorded, so I did want you all to know that, and you will receive the recording and the PowerPoint slides probably tomorrow, maybe today, but my guess is it's going to be tomorrow. And we will also be sharing that in our closed Facebook NDAC group. And just a friendly reminder, if you have not joined our closed private Facebook group for NDAC members, please ask to join. Information about that is in most of the communication I send you, so you should be able to find it. I can't see everyone that's on the call, but do we have any of our board members who are on the call? I like to always recognize them. I don't see anyone today. So I think it is time to share screens and get started. I think I gave you all your housekeeping. I want to say one more time, we appreciate you. You all make an impact, and we're all going to be telling you some ways you do that as we go through this today. All right, let's share my screen. Oops, okay. So here is our NDSC policy team, and they'll be saying a little bit more about it in just a second, but you can see that we have back with us Heather Sachs, our interim director of policy and advocacy, and she is not a stranger to most of you because she's just coming back to help us out for a while. Cyrus has left us for an absolutely wonderful opportunity for himself over at the Department of Labor, and we wish him well and appreciate all he's done. Ricky Sabia is our senior education policy advisor, and of course everybody knows Ricky and the great work she does. Then you know me. And then Chapman Bryant is our policy associate, and Chapman is out sick today. Hence why we're having some of our issues. We don't have him here to ask you. So this is our agenda. I'm not going to go through that because I think you all probably could read it. And I want to jump in and make sure we give everybody as much time as possible to cover what they have to cover with us. And I especially want to be sure that we have enough time for our special guest, Alicia Talbot from Middle Tennessee, to share some of the amazing things they're doing there in Tennessee. I think with that, I'm going to turn it over to Stephanie Smith Lee, a former member of our policy team, but she's kind of ex officio a member of it still. She's serving in the capacity of interim NDSC executive director, and she's got a few things she wants to share with you all. So Stephanie, take it away.
Thank you, Jawanda. I'm currently on hold from being on the policy team. Still following up on some post-secondary things, but currently serving as interim executive director for NDSC, and we have a lot going on. We're gearing up for convention. We have some great speaker proposals in. The speaker proposal deadline has been extended to the end of November. So if you're interested in submitting, it's not too late. We had a wonderful virtual educators conference this past weekend that went very well. And we're starting to gear up for our end of year campaign. I was really pleased to talk with a leader of a local group recently who said that they were going to be sending us in $9,000 from their Step Up Walk. So if anyone has any extra walk money, we're looking for some funding. That's about all I have to share, Jawanda, if you want to go on to the next thing.
thank you, Stephanie. And we're very excited to have Stephanie in this role. And we know that most of you are aware of her illustrious history in the Down syndrome and disability community. And we truly appreciate her stepping up and taking this position. And I will now turn it over to our former policy director and now our interim policy director and my friend, Heather Sachs.
Hey everyone, it's good to be back. You know, as you can tell, NDSC is going through some transition times, but we are strong and we're all rolling up our sleeves and you know continue to work well together to move the organization forward in many different areas, including in the area of policy. Wanted to just spend a little bit of time talking about our congressional policy, our congressional priorities. Jawanda, if you go to the next slide. We are almost halfway through with the 118th Congress. So, you know, a Congress is 2 years. So the next Congress will start in January of 2025. And so at that point, we will go back and, you know, take another look at our priorities and our position statements, which we've developed as well. And I'll talk about that in a minute. We work with our Public Policy and Advocacy Council to develop different priority areas and a policy strategic plan. So, you know, this is based on longtime input from you all and, you know, from the people that we serve. What are the most important things to you that we should be working on? Without a doubt, you know, education is always top, employment, Medicaid, and that includes, you know, long-term services and supports, so our folks can access services within the community. Social Security, we're doing a lot of work on, particularly SSI, and I'll talk about that in a minute. And then we also have the Congressional Task Force on Down Syndrome that we, you know, are always trying to get new members on so that we can educate them. And I'll give you an example in a minute of how we are leveraging the task force as we speak. Our other priority areas, and these are areas that we continue to think are very important. We just don't have the bandwidth to take a leading role in, but luckily we have a lot of very solid allies and coalition partners from other groups. And so we really work hand in hand with a lot of the other national disability groups. So we, you know, we continue to keep up with civil rights, family supports, financial security and poverty, benefits, obviously very important, healthcare, housing, research, we play a supporting role. NDSC does not do research, but, you know, as much as we can support Global and LuMind, we do, and transportation. So, you know, given these priority areas, sometimes we do have to pivot because sometimes we can't control what Congress wants to focus on. So, you know, for example, you know, when COVID hit, it brought up a whole host of, you know, different policy issues that we immediately had to work on. Anything from, you know, ensuring that people could get, you know, visitors in the hospital under ADA to, you know, getting those stimulus checks. So we jumped right in. So we are pretty nimble in that way. Let's go to the next slide. Okay, so I talked a little bit about our congressional agenda. As I said, this has been adopted by our board for the 118th Congress. We also have a plain language version. Please take a look at it, and it's also in Spanish. Please take a look at it if you haven't already. It basically spells out, it doesn't discuss particular legislation, but it spells out NDSC's positions on, you know, basically all the policy issues that we just discussed. And what we've seen is that a lot of the local groups or state-based Down syndrome coalitions have decided to adopt these policy positions as their own. So, you know, please take a look and see if that applies to your group as well. Let's go to the next slide. Okay, so as I said, sometimes we have to pivot. And a couple months ago, the policy team got a call from a member of Congress who traditionally has not been in our network, as you know, being one of our big Down syndrome champions, and they, you know, have a personal connection, and they said, we want to bring a Down syndrome information bill, that we realize that this is a big problem. Many of you may have worked on Down syndrome information bills in your state. There's currently, I guess, about 15 states that have passed Down syndrome information bills, and NDSC has done a lot of work on these in the past. So we've been working with the member's office, and they told us that next week they're actually going to be introducing it. And what this will do is it will require private healthcare companies, so group healthcare plans, to offer accurate and up-to-date information about Down syndrome that has been, you know, developed and vetted by both medical professionals and, you know, the National Disability and Down syndrome organizations. So, you know, we're really hopeful that this will get, you know, good information into the hands of, you know, more people who are getting prenatal and postnatal diagnoses. As I said, the bill is going to be introduced next week. We're really excited about it. We've actually spent the last 2 days trying to connect with members of the Congressional Task Force on Down syndrome to get them to join on the bill as what's called original sponsors. So we will be, you know, when the bill is introduced and we start moving forward with, you know, grassroots advocacy, we will send out an action alert on the bill. But please know that this is coming soon. And, you know, this is something that we can all do to, you know, look out for, you know, the future families who are touched by Down syndrome, to make sure that everybody's getting accurate and up-to-date information.
Heather, I'm just going to add real quick to that. I've already been in touch with some of you today about getting original co-sponsors. Thank you to all of you who have responded. And the way we did that, you know, NDAC is just a wonderful way for us to be able to reach out to these offices, because the original co-sponsor helped identify the task force members that we need to try to get on as original co-sponsors. And we've been able to be in touch with some of you today, and I hope we'll have good results from that.
Yeah, as Joanda said, you know, a lot of times we don't send out something to all of NDAC. We make targeted reach outs if it's your particular representative or senator that that we need to target. So a lot of that is going on behind the scenes, and maybe it's just not happening in your particular state or legislative district. But we are in constant contact with NDAC members on various issues. Okay, so I'm going to talk about some specific pieces of legislation that we're working on. Chapman's really been the lead on a lot of this. Unfortunately, he's sick today, so I've taken over his slides, but I haven't been out of the fold for too long, and I still am able to talk about these bills, because many of them, the bills and issues, unfortunately, have been brought up year after year after year. We know that advocacy is a marathon, not a sprint. So one of the bills that we are actually most excited about, and you may have seen our action alert on it, is the SSI Savings Penalty Elimination Act. So what this would do is increase the $2,000 asset limitation to $10,000 per person for people that are on SSI. That is a huge jump. You know, many of you have probably heard us talk about that $2,000 asset limit before, that's been in place, I believe, since the 1980s, and has not been increased. You know, currently you can get an ABLE account or a special needs trust to work around it, but not everybody has access to that. So we're excited about this bill because it's actually bipartisan. We don't see many bipartisan things in Congress these days. And we are kind of hearing a buzz on the Hill that there's a chance that, you know, this bill could go forward. So in the near future, we're going to be sending out another action alert. We may make some specific reach outs to members, to NDAC members in key states, but know that we are, you know, very heavily involved in trying to raise the asset limitation for SSI. And before you guys ask the question, I absolutely know that it's not just the asset limitation that's a problem, that the income limitation is also a very significant problem. And while we talked to the original bill sponsors about including the income limitation. Unfortunately, just the reality is it would cost the bill a lot more money, the federal government. So sometimes we have to take what we can get and not let the perfect be the enemy of the good. And yes, I see that someone just posted in the chat that this asset limitation also applies to Medicaid. It absolutely does. SSI and Medicaid, and through this, it will touch Medicaid as well. So it'll increase the asset limitation for everyone that's on SSI and Medicaid, since SSI is usually the gateway to Medicaid. We're also working on supporting DSPs, direct support professionals. We know that they are so crucial to helping adults with intellectual disabilities, Down syndrome, access the community, whether it's providing job coaching or transportation or helping with their personal care. We also know, unfortunately, that there is a very severe shortage of DSPs, which was only exacerbated from the COVID pandemic. And so we're working with some provider organizations to try to decrease this shortage and address the workforce crisis. So this particular bill it's a little wonky. It would create a standard occupation classification for direct support professionals. It would basically bring them into parity with a lot of the different healthcare providers, and then would open them up to various benefits from the federal government. An example was again, when COVID hit, the people that already had this classification were immediately given masks, and direct support professionals were not given anything because they did not have this professional class by the government. I'm saying they did not have this professional classification. So stay tuned for that. We're working on that as well. For the Workforce Innovation and Opportunity Act, we call that WIOA. This is a very comprehensive bill that's not just for people with disabilities. There's been a buzz that it's going to be reauthorized. There's been a buzz the last several Congresses. We're hearing that there's a chance they may take it up this Congress. And so what we did was worked with some of our coalition partners. We put together a comprehensive set of recommendations of things that they should address when they do reauthorize WIOA, and we sent it up to the Hill. So if anyone is curious and ever wants to see our recommendations, they're pretty wonky, but I'm happy to share it with you. So just send me an email and I'll send you our letter. We are also we're also in touch constantly with the Department of Labor, and yes, it will be very helpful now that Cyrus is there too. They've really been doing a comprehensive review of 14C, that's subminimum wage. NDSC has taken the position for many, many years that we've come out against 14C and the payment of subminimum wage for so many reasons. But we truly believe that people with Down syndrome should be paid the same as their non-disabled peers. And so what we've done is we sent a letter to the Department of Labor recently asking them to issue a moratorium, so asking them to stop issuing 14C certificates. So that's certificates to different providers, basically enabling them to pay people with Down syndrome pennies on the dollar. And so we're hoping that the Department of Labor will stop issuing these new certificates. Okay, so we are also working on, and this is really Chapman's thing, and I'm sure you will hear from him about this, the Marriage Access to People with Special Abilities Act. We don't like the name, and the name is going to be changed. So we're working with the offices in charge of this to come up with a better name. But what this basically will do is get at the marriage penalty for people on SSI and Medicaid. Basically, again, going to that asset limitation, the way it's currently structured, there's major penalties if you actually get legally married. For example, people, individuals on SSI, will get payments of $2,000 a month, and I'm sorry, have an asset limit of $2,000. And people who are married on SSI, instead of having an asset limit of $4,000, they only have an asset limit of $3,000. Similarly, the monthly payments that they're getting from SSI are much decreased, because there's this assumption that, you know, when you're married, you're sharing resources, and that you don't necessarily need as much money, which has proven to be false. So we're working on this bill. It hasn't been introduced yet, but we're really excited about that. We know that marriage access is a huge, huge priority for you know, many adults with Down syndrome that have talked to us about this, and just know that we're working on it. So, okay, so I have talked a lot. I am going to now turn it over to Ricky. I'll take a look at some of the questions in the chat, and please email me if you have any specific questions about any of these bills or any other bills. My email will be at the end of the presentation. Thank you, and take it away, Ricky.
Okay, so we're always working on a lot of education things with limited time. We're only touching on a few things today. But Ricky Sabia, me, had co-authored a TIE Center brief, which has been updated with some new resources. We wanted to give you the link to that. And also at the TIE Center, there were a number of resources, including 9 parent briefs that I helped co-author as a parent liaison to TIE Center while it was funded for 5 years. So look at that website. Also, OSEP, the Office of Special Education Programs, recently released fast facts, and they've been doing this around a lot of populations, but this one was about children identified with intellectual disability. And of course, you know, in there are some not very happy facts about the lack of inclusion for these students. Of course, we're working on that all the time, but this just gives you some data, you know, by states, and data about disproportionality around race with segregation, as well as discipline, and you could look at that. Also, there is a 1% cap on the number of students who are permitted to take an alternate assessment under the Every Student Succeeds Act. But states have been allowed under the law to be granted waivers, and most states have been requesting waivers since the bill was passed in 2015. They were requesting waivers since, I believe, 2017. So these waivers have to be submitted 90 days before the spring testing window, and they're supposed to get public comment. So this is around the time where states are going to be supposedly getting public comment, but they're just posting them places, and parents and advocates are not necessarily aware. So the Advocacy Institute, with help from us in finding these on the various state websites, has them all collected at this website here, and you can look and see what is going on in your state. There's useful information in these waiver requests. Even if you don't feel you have the bandwidth to comment, it's still good to see what they're promising to do, not to put so many kids in the alternate assessment. Next slide. Okay, so one issue we decided to focus on today is the brief that we did on guardianship. And it's not just for students with Down syndrome, but that's who we're focused on. And I hope you've already seen the brief. I know it's been sent out. The next slide will give you a link to get to it. The brief is supposed to demystify what is and is not necessary for families to remain involved. I think you probably all know that at 18, in at least most states, the rights transfer to the individual with Down syndrome to make the decisions about the rest of their education. And a lot of states are telling parents, well, you have to have guardianship if you want to be involved in these decisions. And that actually is not true. The states are a lot of states are not following the IDA regulations. And there is a link in there where you can see somebody did a study, and they have all links in the various states of what states are doing and not doing. But in the regulations that say that the rights transfer at 18, there is an exception which says that if a student is not judged incompetent or incapacitated, so in other words, if there's not guardianship, but that student still is not able to make educational decisions for him or herself, then the state is supposed to provide ways, alternatives to guardianship for a parent, or if not a parent, someone else, to help make those decisions. And OSEP went even further in guidance, and this is all in this brief, which said that guardianship is very restrictive. There need to be other ways that states provide for this, and also talked about not only if they can't make decisions, but if they don't want to be the ones making the decisions, which sometimes happens. So this brief is very important. It's got a lot of good information. There are a lot of people that we reached out to in our national partners, and also had a little committee of experts. If any of the experts are on the call, we thank you very much for your input in this. We include recommendations for families as well as policymakers. We have sent this to the Hill. We have sent this to the Department of Education, and they are reviewing it, because even though they have these regulations and this guidance, states are not necessarily following it and still telling parents this, when they could just have a simple form that allows the student to provide their parent or whoever with the freedom to help them with these educational decisions, or even a power of attorney in certain states. So please take a look at this, especially if your student is approaching that age 18. The next slide, I believe, has the link. Yeah, there's the link and the QR code. And I thank you very much.
Thank you, Ricky. Appreciate that. Ricky worked really hard on that, and it is a really good piece of information to use to guide people and to share with schools and families. I'm just quickly going to show you two slides. One is to show you we have 854 NDAC members across the United States. We are represented in all 50 states. Kudos to all of you. We also have 106 self-advocate members, but we are missing states where we have self-advocate members. You can look at this again when you get the slides, but if you know self-advocates, which simply stated is just individuals with Down syndrome who live in any of these states who might want to join NDAC, I would appreciate it if you would connect me to them, or if you could send them information, because we feel like it's really, really important that we have people with Down syndrome represented in every state and have their input on what we're doing. So you'll be able to see this in the slides when you get those, so I'll leave it at that. I have a few more slides at the end, but we want to give Alicia Talbot, Executive Director of the Down Syndrome Association of Middle Tennessee, as much time as possible to talk about what they've been doing in their state. And Alicia is an amazing leader. She has truly embraced advocacy and has become a leader there in the state of Tennessee. And I am a little partial to the state of Tennessee because that's where my daughter was born. So Alicia, with that, I'm going to turn it over to you and let you tell them about all the great things you guys are doing.
And you're going to change the slides for me too?
I am going to change the slides for you too. Are you ready for me to go to the next one?
No.
Okay.
I do want, I think all of that is more than needs to be said. And sweet Joanda has always been such a good friend to me. But you don't have to listen to everything she says about me. I'm just a parent who has done this for 11 years now. And have actually really enjoyed the advocacy part of my job. So go ahead. I hope this is helpful for you guys. I do want to start. I don't know how far anybody else is with their advocacy program, but when I started 12 years ago, although the organization had previously had some advocacy and done very well, there was a downtime before I came around. So I was basically building that from scratch. And by no means is this like follow this and you're great. This is just the way we've done it, and we have had quite a bit of success. So I just wanted to share that with you. Depending on where you are in your advocacy journey, there's always room to grow, and we certainly have lots of room for improvement. But this is some of the cool stuff we've done. Okay. So my first step was to get my board of directors excited about the idea of advocacy. And as you know, sometimes it's very difficult to get parents excited about advocating. It seems very intimidating. But the first sell job was to my board of directors, which we did pretty early on, when we we had a declaration done the week of 3/21 to name whichever day it was, March 21st, whatever year that was Down Syndrome Awareness Day. And so it started to get the board involved because we all went down there. They let us on the House floor. It was a big production, and it got them excited about what we were doing. So it was kind of like the first step. Go ahead, Joanna. The second main thing that I did was create all kinds of partnerships. And these have really been key over the years. There are actually 7 Down syndrome associations in the state of Tennessee. And I'm very happy to work with all of them, but also local groups. We have the Tennessee Disability Coalition, Autism Tennessee, Gigi's Playhouse. These kind of local organizations from a state level have been instrumental because we all do better when we're advocating together as a group as opposed to separately. And certainly sometimes other groups have much better ideas than I do. So it's always been great to work together. And we're very proud of our national partnerships as well. Certainly the National Down Syndrome Congress, NDSS, Global has been fantastic as well. And all of the others that we've been able to work with and help us meet our goals. So one of the early things that Joanna talked me into doing was to restate our Down Syndrome Policy Network of Tennessee so that we could make some difference on a statewide level. So we've limited it really just to Facebook and then emails. The reality is when there's an important bill that comes through, I'm making some phone calls to those partners and saying, who do you know who has so-and-so as their legislator? That's who we need to hit. Just the exact similarly to what Heather was saying. We do that on a state level. But this group, we kind of managed it from Facebook, but it has been very instrumental in helping us to just kind of rally people and keep people informed. So it can be a very simple as just a Facebook group and then have the ability to connect with people across the state when you need them. Because you certainly, if you're a state like us and we have 95 counties, you can't just do it just one person by themselves or one group. Joanna, did you add my slide somewhere else?
What slide?
My index slide?
No, I did not add it. I'm sorry.
Oh, okay. So I'll just go ahead and say when we're talking about our national partners, that this particular group has certainly been beneficial, as well as when the conference comes around, we generally appoint a self-advocate of the year, and they have the option to attend a couple of different conferences, one of which is the National Down Syndrome Congress, to attend the self-advocate track, and the advocacy boot camp. I don't know if any of you, Joanna references me as Senator Talbot all the time, which makes me laugh. But that's one of those things that is always beneficial to our self-advocates and all of my staff and families who have attended. So if you have not been, there's my commercial for Joanna because she does a fabulous job with that. Okay, now you can move. So oftentimes, and I find this with my board members a lot, they have no idea who their legislators are. And I'm always puzzled by this. You have to know who they are and know them personally. And there's all kinds of events that you can go to and see them at, and they appreciate that. They want to know that you care and are involved. You know, as an organization, I can't really say, hey, go vote for, you know, Susan Lynn or Diane Black or whoever else is running. But what I can do is just show up and thank her for the things that she's done for our population and invite her to things that we're having, because it just keeps that dialogue going back and forth. And on the left is my own personal senator with my daughter. And I'll tell you a little bit about that particular instance in a little while. Definitely leverage relationships. One of the best things that we found out was we have in the state of Tennessee two representatives who have grandchildren with Down syndrome. One is here in Nashville. That's Representative Sam Whitson. He has been a phenomenal advocate for us and has helped with all of the legislation that we have put forth, but also other legislation that we were discussing, either advocating for or against. He's made some meetings happen for me that probably would not otherwise have happened. So like that's one of those things you want to know. Do you have a grandparent? Do you have a parent? Certainly be able to leverage those relationships. And I put this on the left here. We've done a couple of different events for legislators. This was a breakfast. Again, we generally try to coordinate those in conjunction with, if the House or the Senate are meeting on 3/21 and we're declaring that Down Syndrome Day in the state of Tennessee. That way we already have a reason for families to come, because they get very excited about going on the Senate or the House floor. It's really cool, and in Tennessee it's broadcast. It's exciting. And a couple of times we've actually had self-advocates, give a little speech, or I've given a speech at that, but we've held these breakfasts. And during these breakfasts, it's a come and go. But our, my legislators, I certainly make a personal ask, and we have families make that personal ask, and they have been very well attended. It's a grab and go. Believe it or not, Chick-fil-A is a huge hit, and it's cheap. And they deliver it right there, and I don't have to pick it up or any of that. So that's been very successful. And when we have them pick it up, we have lots of families there, and we showcase our self-advocates. And it's great for both us to have that exposure with them, but they love coming and taking pictures with our families that they then post as well. Okay. Am I going too slow or too fast, Jawanda?
You're doing great.
Okay. So education, of course, all the DSAs and NDSC and all of us, we're trying to educate everybody. But one of the big things we do is educate our families and also our self-advocates. So we have some tip sheets on telling your story. We have some other ones from an advocacy perspective. We have a place for resources on our website in terms of advocacy. And we certainly partner with the Vanderbilt Kennedy Center. Shout out to Elise McMillan, whose smiling face I see there, and certainly have promoted and both attended and partnered with some advocacy workshops here locally to help people not be afraid to advocate. And that seems to be the biggest kind of fear, I think, is just being afraid and being intimidated. And I always say, once you get to know them, they're just like everybody else. We all put on pants the same way. We all, get messy sometimes. And so there's, they want to hear from you. And I think convincing people of that is often, it's easy to do, but they're not expecting that. And so you get them through that hurdle. Okay. So we also do some calls to action. A lot of times, I'm going to be completely honest, we're copying what NDSC or what Global or any of our other partners are sending out because that's important and saves us a little bit of time. But these are a couple of examples of things that we have sent out, again, just to particularly on legislation that we are talking about. Either things that we're trying to, again, advocate for or against. And there's our Able Estate Recovery Bill, which we actually passed here last year. And then some other calls to action. And so again, we use social media and email for that.
Hey, Alicia, your Able Estate Recovery Act, is that your Medicaid clawback?
Yes, it is.
Okay. Because I think some people may recognize that.
And I think don't I have that one later down under the legislation piece?
I do not remember.
I think I do. If not, remind me.
Okay.
Because I will talk about how that came to be. That's a fun Jawanda story. Okay, you can move. So the other thing we did was we actually hired an advocate. Erin Richardson is an attorney by trade and has done a lot of school advocacy for our families. And so we said, hey, what do you think about this legislative stuff? Let's get you involved in that as well. And it has been wonderful to have a dedicated person, and she's able to split her time both to help us prioritize and keep informed on everything the way Heather and Jawanda do, but also to help our families. So she's critical in the creation of a lot of our materials, but also our meetings and trainings. It's fantastic. So if you're lucky enough, that it's worthwhile to have that kind of dedicated person, because it's a lot of work. Okay. Certainly national. What?
There's your slide that you were talking about earlier.
Yeah, so certainly I encourage you or anyone to attend any of the national events from an advocacy perspective. There's also the Disability Policy Seminar. The ARC has a national convention, and there's just always something. And you can just attend and listen. You don't have to be knocking on doors of senators. But those organizations have done a fantastic job over the years of scheduling meetings for you and, giving you talking points and training to make those things very easy. So we certainly encourage you to do those things. Okay, where do I go next? Again, so we have Disability Day on the Hill in Tennessee, which is sponsored by the Tennessee Disability Coalition. In his organization, we typically sponsor part of that or assist with that. And that's, crosses, all the disabilities. And it's important, I think, when most legislation that we as Down syndrome organizations or Down syndrome parents are going to push forward will not necessarily be Down syndrome specific. Some are, but the majority of time they're not. They're really for anybody with a disability or intellectual disability. And so, again, there's power in numbers, and we're certainly stronger together than we are separate. So we certainly do the Disability Day and encourage folks to attend that. But if we're able to coordinate a Down Syndrome Day on the Hill on 3/21, we take advantage of that. And we send everybody down. And it's a big day. We schedule meetings for people. We help them. We generally actually have small gifts for our legislators. I don't know how Joanne feels about it, but we usually use kind of a small token that families can pick up and share. But it is a fun day. And people are always surprised at how friendly folks are. Getting yourself advocates involved. This is really huge. As parents, most of you, I think on the call, a lot of you are parents of kids with Down syndrome. Get them involved. Their stories are incredible. And having them say, if they're able to, in whatever way they're able to, talk about how something affects them goes a long, long way. I was able to, you learn that really quick. I can have great relationships, but when my daughter spoke to that senator, he was like, come talk to me more. It's just hearing it right from somebody who's affected is very influential. Okay. And speaking of self-advocates, Joanna specifically wanted me to tell you about this particular program that we started a couple of years ago. This is actually, we call it Our Stories. And what we started out to do was really to train self-advocates and their parents, if they were underage, of course, to tell their stories. And it started, you can go ahead and flip, Jawanda. It really started with, what is your story? And a lot of, we had to help them in a lot of ways with what their story is and what should be included in their story. And so over the course of, I think, about 6 to 8 weeks, we did a number of trainings. We had representatives speak. We had a lawyer for the state speak. I did a training. We had someone from Autism Tennessee do a training. This was a partnership between us and them. And so this is about half folks with Down syndrome and half folks with autism. And then we basically taught them how to craft that. So when they needed help, we helped them with wording. And at the end, you can go ahead and flip. We had an event. So the whole thing culminated in an invitation to a dinner. And we had a very lovely dinner. And each person both created a written story and they created a video story. And then we put all those together and played those during dinner. And Jawanda, are you able to click that link that's on that bottom one there? Yeah. Oh, wait, go back. Not that one.
Oh, me. Okay.
Right, see the little play button? It should let you play that. That. Oh.
It's not.
Oh, man. Okay, so what I want to tell you about it, we got a lot of media coverage from it, which was fabulous, but I was hoping the news guy could explain it better than I could, but the
Alicia, let
Yeah.
me interrupt you just a second. When we send the slides out, I think they will be able to click on the link and watch it.
Okay, this is
Okay.
just one of the news pickups. And when she's clicking that, it's actually going to the part on the website, which will take you to the videos themselves, and you can actually watch all of them. And you can also look at the print ones. And if you go to the next slide, Jawanda, you can see what that print one will, what they look like. And we put them together in this very nice little book. So everybody at the dinner got a copy of this. And what was amazing is there really was no ask, right? We didn't set out to say, hey, this is a bill, we want to have it passed, and here's everybody's perspective on it. We taught people how to come up with their story, figure out what was important and what they wanted to share, how they could share it in writing and video. We cut those down. So throughout the dinner, they watched, 4-minute clips from each person. And what's amazing is at the end of this dinner, the legislators were coming to me saying, I never knew that was a problem. Can you tell me more about that? Can we set up a meeting? So our own senator looked at my daughter after she talked about public school issues that she had gone through. He was like, let's talk about this, because she actually had some suggestions, imagine that, for what could be done. And he said, I think we could make some of this happen. So the great part is at the kind, we kind of envisioned it just kind of ending, but it created like a secondary part of the program in which, now we're working with them, looking at what kind of bills would we want to put forward for next year. And yes, that's Elisa's son, Will, Stephanie. He was a great participant in this. And it was all during COVID. So we had like hybrid training. We were doing all these Zoom calls like this. And then some in person. So it was kind of crazy, but it turned out to be the most wonderful thing ever. So if anybody here is from an organization and wants a great idea, this was really spectacular. And we're still talking about it. Okay. So passing legislation is the other thing. And you can go to the next slide. It's just kind of a transition slide for me. Our organization has actively pursued specific legislation. The first one was the Down Syndrome Information Act, which required the Tennessee Department of Health to actually put up-to-date, accurate information on its website, both for parents and for providers. And then we partnered with Vanderbilt Kennedy Center to make that happen in a short time period. So it was a wonderful bill. And there was not a big fiscal, there wasn't a fiscal note on this. So it was a very quick, and for us, it was a fairly easy one to pass, which really then further got the excitement going both in our community and with the board. What's the next one, Jawanda? We moved to organ donation. And although we know it's a federal law, we did hear from families who felt that their children were not eligible for organ transplants simply because they had an intellectual disability. And so we pursued the organ donation or the non-discrimination in organ transplants. We secured those sponsors. And then we also had our allies, these other partners that we had mentioned, help us. And that was another bill that we passed. Is the next one is this the Medicaid? Is this the clawback from this is last year's? Yeah. So this is last year's bill. This is what Jawanda referenced, the Medicaid clawback. So I found out how many years ago, Jawanda, when Arkansas passed the clawback?
Kansas.
How many?
It was Kansas. I don't
Kansas.
live in Arkansas anymore. I have not lived there in a long time.
Okay,
oh
isn't
my
it the same
goodness.
state, really?
5 years ago, probably. I don't know, something like that. 4.
So So this all started when I found out what they did. And we were talking to families who were not enrolling in ABLE accounts because of that clawback. This was money their young people that they were working for and putting in, or their people were earning and putting into these accounts, and they didn't feel that was appropriate. And so basically, and I'm just going to be completely honest, I called Jawanda and said, what did you do? And she sent me everything. And so then, because this didn't affect just Down syndrome, I went to our local partners and said, how do we make this happen? And we actually allowed the we asked the Tennessee Disability Coalition to really kind of take the lead on this because of their lobbying efforts. And because there was obviously a fiscal with this one. And so we were very excited. We really kind of thought the first year out, it would just be some chit chat and we wouldn't get very far. But we actually passed that last year. And so we're very proud of that. And it's just a great example of working from, not recreating the wheel, networking, connecting with people who have already done it and been there, and learning from those.
Great example, Alicia.
And this is just an example. I didn't really mean to pick all these pictures of Will, at least, but we have a self-advocate program. I didn't put that in here, but every year we pick one individual with Down syndrome who really is doing a great job and making a lot of progress for those with Down syndrome. And Will is one of ours. And so we, really try to use them as much as we can in public speaking opportunities. And this was actually Will advocating for the Step Up legislation in 2013, which provided scholarship dollars for those in the post-secondary programs. So we were very excited to support that. We certainly didn't write that and that legislation, but we definitely helped with all of those other folks who were doing that, at least McMillan included. So I had to include that as well. And that's it. If you have questions, I'm happy to answer them. I hope that's helpful in what you wanted, Jawanda.
It is. Does anyone, we have just a few more slides, but does anyone have a question they haven't put in the chat? While we are, if somebody can watch for those, because I can't send. Cindy Lou, you can unmute yourself and ask your question.
Hi, I'm cooking dinner in the background, so I apologize. I don't have my camera on. Alicia, that is such amazing work. And so many great examples that I can borrow for what we're doing here. I'm curious, can you talk a little about sustainable funding for your organization? What is and how?
We just had a conversation about that just today at our staff meeting earlier. So we have a very diverse revenue stream, but it's still hard. It's just hard. And most of it's coming from individual and corporate donations, of course. And then we also, which I did not put in here, but I don't know if the other states do this as well, but we had the opportunity, you can actually put a bill, you have to write a bill for it, yes, to get a specialty license plate. So we have a Down syndrome awareness specialty license plate. So individuals pay, and then you pay an additional, I don't know, like $60 to get that. And then you just do that every year. And we actually get half of that money, which we earmark specifically for advocacy and part of our program that serves people anywhere in the state of Tennessee who come to Nashville or this community. So if you're from East or West or somewhere not in our service area, but you come to Vanderbilt, which is here, and a lot of people do, we certainly come and help you there as well. We don't go, I'm sorry, you're not really in my area, so we're not going to bring you a meal while you're in the hospital. We take care of everybody who's here. And so that money, that's part of how I think we achieved buy-in from all of the different organizations to help us sell those. In Tennessee, you had to sell 1,000 to get it, pre-sale. We didn't sell 1,000. We ended up buying about 300 to push us over the edge. But every time they renew, that money comes to us. So it's an ongoing revenue stream. So if your state does those, It was totally worth buying out the rest of them. We gave a lot of them away. We did them as walk prizes one year. We've done them for new parents, you know, and then we just allowed people to sign up so we could get, you know, through that. We had keychains made. We promoted them. We continue to promote that statewide. But yeah, it's just everything else.
We are running out of time real fast, and please email us, or I will provide Alicia's email in our follow-up email. But I did want to say, she said about giving the gifts. The only thing on having gifts for legislators, there are some rules that apply to that. And sometimes, especially on the federal level, they are not able to take what you give them because it can only be worth like $3 or $5 or something. I can't remember, but
ours are like that. They're usually like small cups that say DSMT or, you know, celebrate the extraordinary, and then families put a candy bar in or something. I mean, they're very small when I say small.
Yeah, Roxanne said check your state's ethics commission, and that's just you wouldn't want to do something to cause somebody to get in trouble. That's the only warning there. But Alicia, this was absolutely great, and we appreciate it. I love what Alicia talked about. She and I have been friends. We have a mutual adoration society, but we also, I mean, the examples she gave of reaching out to me, I reached out to some of you. I reach out to many people when we want to do something in Kansas or another state wants to do something, needs help. I would love to see you all do more work sharing in our NDAC group, because it's a great place to post something and say, hey, has anybody done this in your state? One other thing, then I'm going to jump through these slides in less than 3 minutes. You know, Alicia and them are doing a great job. They have challenges in Tennessee, but they also have some really great things going on, which is true of almost every one of our states. There's always something good, even with the challenges that come. But they have been able to create they don't have the most active Down Syndrome Policy Network for the whole state, but they're doing what they can. And I think she gave a great illustration of that. They mainly just do Facebook and some emailing with that. I want to encourage you all. Some of you have really active state advocacy coalitions. A few of you have a Facebook page, but you know what? We all do what we can do, and you get something from that. So it's something to consider if you don't have the bandwidth to do a very active statewide coalition, just doing a statewide Facebook group or some type of group like that. And I can help you with that if you need. Action alerts, please sign up. NDAC members, please get in the NDAC group. This is our NDSC social media. I have to do an ad for the NDSC convention 2024 in cool Phoenix, Arizona, July 25th through 28th. We have extended speaker proposals through November 30th. There's a link there to do that. I know you all know some wonderful people who deserve awards. Please nominate them. You will get all of this information by email. It will be posted in the NDAC Facebook group. And so you will have all of these links. I wanted to draw your attention to two things. One, the second one on this page is on education. It's the OSEP updated technical assistance resource. I think I posted that in the NDAC group yesterday, but that's something for you all to know about. So check that out. I also, you know, our employment stories, anything we do on employment on social media at NDSC, our likes, hits, engagement soars. We were able to get Jeff Navor, the Vice President of Hospitality Services for the University of Kansas Health System, to write a blog and do a video about what they're doing at the University of Kansas Hospital to employ people with disabilities. And it is a great blog. He does his top 6 for employing people with IDD. And it is a great resource to share with employers, with families. And so I want to draw your attention to that. These are the dates for our NDAC calls in 2024. Those are also in the letters you get from us. Those letters come through a Google group. We will be transitioning to a different platform, but I'm not sure when, but we'll make sure that we let you know about that. Last but not least, this is all of our contact information. Alicia's is not on here, but I will send it to her. To you. All right. We have, what does my clock say? We have 1 minute. Anybody have a question?
Hi there.
Yes.
Yes, okay. My question is the Down syndrome. I'd like to say thank you for a very good job doing with the Down syndrome. I hope you'll be able to join up with the autism group later on. Yeah.
I think you said thank you to me, but it could be to somebody else.
Yeah.
Thank you.
Sorry about that. I'd like to say thanks for your wonderful presentation on Down syndrome, and I hope you'll be able to assist people with other disabilities, including autism as well.
Yes.
With other groups. Yeah.
Yes.
All right. I think that's everything I see. There's a few things left over here in the chat, and we will make sure we follow up with anybody we didn't get to. If for some reason you miss us, please reach out to us. We're not trying to ignore you. We just accidentally missed you, and we don't want to do that. We always want to be here to respond to you and help you out. Alicia put her email address in the chat. It is Alicia, ALECIA at somethingextra.org. And our next meeting is in January 23rd, 2 p.m. Eastern time, and you will get an invite. And with that, I think we're all going to sign off. Alicia, thank you. Heather, glad to have you back. Chapman, we hope you get to feel better, even though you're not on today. And Ricky, thank you for always taking care of us with education. Everyone have a very happy Thanksgiving.
Thank you, Joanna.
Oh, thank you too, Stephanie.
Thanksgiving to you.
Thank you for all you do, Joanda and Stephanie and Heather and Alicia.
All right. Thank you, guys.